Hi, Dr. Smith.
Hi.
It's really nice to meet you, and thank you for meeting with me today because I have a few burning questions, mainly about breast cancer.
Awesome. I'm excited to be here.
So why do you think it's so prevalent these days?
It's hard to know. Breast cancer is just common. It has been common. It is common. It will be common. 1 in 8 women in a lifetime these days are diagnosed with breast cancer, unfortunately.
Why do you think so many women delay coming in for a mammogram?
That's a good question. I think there's a lot of fear about having a painful study. And I can tell you that with our new technology and our new tools, mammograms are now very comfortable.
They are. They're not painful. And I try to tell other women that you should go do this.
Yeah, agreed.
It's really worth finding out that you don't have it.
Exactly.
And it's worth finding out if you do as well. So why is this early detection so important?
So early detection is really important because we're really good at taking care of breast cancer. We're really good at curing breast cancer. If we can identify breast cancers that are confined to the breast, the 5-year survival is 99%, which is a phenomenal number in any cancer treatment. And if we unfortunately don't find cancers confined to the breast, let's say the cancer is spread throughout the body, the 5-year survival drops to about 30%. And so if we're able to identify those cancers early, we're really good at taking care of them.
Yeah, that's a good reason to come in and get that mammogram. When should women, or even men in some cases, think about having a mammogram?
So for women, for average risk women who don't have an extensive family history of breast cancer, we recommend that women start screening at age 40 and then yearly thereafter. There's a lot of different guidelines in the literature these days. This is a hot topic, but we know to save the most lives from breast cancer, we need to start screening at age 40 and then yearly every year after that.
Very good. So you just answered my next question. I was going to ask you how often. So annually?
Annually, yep, annually. And you did mention men. For most men don't necessarily need screening unless there's some compelling reason to have screening. Men can still get breast cancer, so we want those men out there to come in if you feel a lump, if you feel something abnormal that lasts more than a couple of months, come in and get it checked out, because men can get breast cancer, but they don't necessarily need annual screening.
Okay, good. I'm glad you touched on that. Is there any risk with the mammograms, like maybe radiation exposure?
That's a good question, also a hot topic. No, the answer is really no. All radiation risk is theoretic, and we extrapolate, from the atomic bombs what radiation risk can be. We know that the radiation from a mammogram is very safe, and the benefit of the mammogram far outweighs the radiation risk. The radiation level from a mammogram is less than a chest X-ray, and it's about equivalent to just living on Earth for 7 weeks. So when we live on the ground, we're exposed to cosmic radiation, we're exposed to radon gas radiation. By living, we're exposed to radiation. And so
that should take care of that fear.
It should, yes.
What other fears do you think women have about coming in for a mammogram?
Yeah, I think, pain is one, like we touched on. We've got great equipment here at Essentia Health. We've got, state-of-the-art equipment. We've got these beautiful curved paddles that you can see right here that actually make a mammogram far more comfortable. So, comfort is one. I think fear of diagnosis is another, and I think that knowing that we're so good at taking care of breast cancer when we catch it early should really get women in.
I agree. And then you have the 3D as well, right?
We do, yes.
And is that routine, or is that in certain cases?
So we do it on almost everybody. Most insurance companies these days will pay for the 3D mammogram. We know that the 3D mammogram detects about 40% more breast cancers than the 2D. Now, 2D is still good. It's a great technology. But in most people, we are using the 3D mammogram these days.
And you touched on something with some people might wonder, what about my insurance? So like you said, they are willing to pay. They'd rather pay for something that's preventative than to pay for a long-term care or treatment plan.
Exactly. Yeah, insurance companies are actually mandated by law to pay for a screening mammogram, a 2D screening mammogram. Now most pay for a 3D. And so women can check with their insurance companies or actually call our financial people here at Essentia, and they can help figure out what's covered by insurance. But all mammograms are covered.
So if someone is thinking, I should go in for a mammogram after seeing this, how do they get a hold of someone to make an appointment?
Some people don't know that you don't need a doctor's order to get a mammogram, so you can just call Essentia Health and ask for one. It's as easy as that. You can, of course, contact your physician and they can put in an order. And you can even walk in off the street and come to the front desk and say, hey, can I get a mammogram? And we'll work you in.
That's awesome. What signs or symptoms should a woman look for if she hasn't had one and thinks, I have a concern? What would be those signs or symptoms?
Yeah, that's a great question. So feeling a lump or a mass that doesn't go away is one thing that we always should be concerned about. Breast cancers are commonly and almost always rock hard when you feel them. So if you feel a rock hard lump in your breast that doesn't go away after a couple of months, we'd want you to come in. Any unusual change that sticks around for 2-3 months, it's worth getting checked out at least by your primary doctor, and they'll order the appropriate studies and tests.
Good. Anything else women should know to be prepared for coming in for a mammogram that you can think of?
No, these are really routine, straightforward. They don't take much time. Most women come in, we give them the option between a room temperature gown and a warmed up gown. You just put the gown on, come in, you get 4 pictures. Takes about 10 to 15 minutes. It's very, very easy.
Excellent. And my last question for you is, how do they get the results?
So results are mailed, so everybody gets a result through the mail, and you get one through MyChart as well. And if there be anything on a mammogram that we need to take a second look at or look further at, our department will call patients directly and talk with them about what needs to be done.
Good to know. Thank you so much for all this valuable information. My hope is we're going to get the women in here to get that mammogram.
Me too. Thanks so much.
You bet. Thank you,
Thank
Dr.
you.
Smith.